Bismillahirrahmanirrahim. Today we will discuss dental cements based on organometallic chelate compounds. Already we have discussed the requirements of the cements used in dentistry. Now the organometallic chelate compounds. Chelate compounds are those which comes between divalent metallic ions such as zinc ions and ortho-di substituted aromatic compounds. There are three types of aromatic compounds delineating the three groups of materials. First group is zinc oxide eugenol cements. Number second is the orthoethoxybenzoic acid or EBA cements. And third one is the calcium hydroxide cements, in which the aromatic ligands are salicylates. Now, zinc oxide eugenol cements. Presentation is liquid powder, not like the pastes, powder and liquid. But two-paste system is also available. In two-paste system, there are two pastes like we have studied in zinc oxide eugenol impression materials. Products containing hydrogenated rosin or polystyrene, are known as resin reinforced zinc oxide eugenol. As we mix for impression materials equal amounts in powder and liquid form, definite volume of powder will be mixed with number of liquid drops, which were recommended by the manufacturers. Some manufacturers supplies a scoop for miring powder. Mixing powder and liquid on glass slab or paper pad, as we have seen in impression material. A paper pad is there. Pastes for of contrasting colors. If pastes, then they were mixed like impression zinc oxide eugenol pastes, and a streak-free mix is required. Easy for proportioning and mixing mean if pastes of contrasting color are there, so we can proportion and mix in an easy way. Thin mix should be avoided, as we have or we are doing in our impression pastes. For restoration or for cementation, we have to use a thick mix. Thin mix have inferior properties like low strength and higher solubility. Composition, typical composition of a zinc oxide eugenol cement is, if we see the component and the function. Powder contains zinc oxide, which is primary reactive ingredient, and zinc acetate 1 to 5%, which is accelerator. And liquid is eugenol, which is again a primary reactive ingredient, and olive oil, which is used for controlling the viscosity, and olive oil is 5 to 15%. Zinc acetate in the powder acts as an accelerator by helping to create an ionic medium. Setting reaction is chelation of two eugenol molecules with one zinc ion to form zinc eugenolate. Reaction is slow in the absence of water. So water acts as a as an accelerator. Chelate mean class. Chelate mean class. Panje. In this reaction, a molecule of water also produced. Setting which again accelerate the reaction. Setting characteristics to some extent is ideal. Adequate working time, very little increase in viscosity. Rapid setting after placing into the cavity. And rapid setting is due to these two important factors. Number one, residual moisture in the cavity accelerate the reaction. Number two, higher temperature of the mouth accelerate the reaction. But as we prepare cavity, we have to dry it, or cavity is having a little bit of moisture, but this little bit of moisture is enough to accelerate the reaction. Not a mouthful of water is necessary to accelerate the reaction. Now mechanical properties, compressive strength is lower than zinc phosphate cement. Normal material shows 20 megapascal. Reinforced materials shows 40 megapascal compressive strength. And strength developed rapidly. Reinforced material are better than normal, and correct technique is the road to success. This is the success. Now thermal properties, as it is insulator, it forms thermal barrier and can be used under metallic restorations. Value of thermal diffusivity is similar to dentine. Biological properties, unconsumed eugenol leach out from the restoration, irritant to pulp tissue in some conditions, having an obtundant effect on the pulp. Obtundant mean soothing. Free eugenol bactericidal. And minimize effects. Which effects? See your book. Free eugenol is bactericidal. And what comes in mind that it minimizes effects of what? See your book, because you have to see the book also, not rely totally on my lectures. You have to see the book also. Now bacterial ingress and production of exotoxins. If you use your mind, answer is there. Now, which causes pulpal damage due to micro leakage. Now, highly soluble and replaced by water is the component which is called as eugenol. And that as eugenol is highly soluble, it causes hydrolysis of the zinc eugenolate and disintegration of the cement structure occur. If zinc eugenolate is not there, it hydrolyzed, so disintegration is there. So that is why it is not suitable for luting except for temporary basis. In resin-based material, it inhibits polymerization. As already discussed, that it cannot be used or it may not be used under the composite materials. And sometimes it causes discoloration. Clinically, softening of the surface of the composite also seen when it is used as base under the composite restoration. Resin-based adhesive loading system also face same problem, especially if a provisional restoration is loaded using a zinc oxide eugenol temporary cement. Discoloration and the other one. Which other one? Inhibition of polymerization. Now, application of zinc oxide eugenol. It can be used as lining for deep cavities and bases, lining under amalgam fillings, as already described. That it must be used under, or it can be used under metallic fillings, lining alone or a sublining of zinc phosphate. Sublining. Till now we have seen lining. Now this sublining. So if we say that this is a tooth and this is a cavity, so if we have this material here and another material here, so this will be our sublining and this is our lining. So sublining of zinc oxide eugenol and sublining of zinc phosphate. So it can be used as temporary loading cements, temporary filling material, and widely used as root canal sealers. It is also available in paste form. Orthoethoxybenzoic acid cements. Presentation is powder and liquid. Orthoethoxybenzoic acid to eugenol ratio in the liquid may vary, usually about 2:1. Orthoethoxybenzoic acid 2 and is present in 2 and eugenol present in ratio 1, or orthoethoxybenzoic to eugenol ratio is 2:1. Structure formula of both is same. It also forms chelate compounds with zinc ions. Structure of zinc orthoethoxybenzoate is similar to zinc eugenolate. As I have discussed that the impression paste which we are seeing nowadays or using, it is not the zinc oxide eugenol. It is the zinc orthoethoxybenzoate material. So composition of orthoethoxybenzoic acid cement is: powder is zinc oxide 60%, quartz 35%, hydrogenated rosin 5%. Primary reactive ingredient is the zinc oxide, and reinforcing agents are the quartz, hydrogen rosins, while liquid is orthoethoxybenzoic acid and eugenol, and these both are the reactive agents. Properties: setting similar to zinc oxide eugenolate, affected by moisture, possible to achieve higher powder liquid ratio. Powder consists of inert reinforcing filler. Set material are stronger than reinforced. Reinforced zinc oxide eugenol due to zinc oxide eugenol due to fillers and high powder liquid ratio. Now, high compressive strength, that is 85 MPa. Here 20 for not reinforced material, zinc oxide eugenol, and reinforced eugenol is 40 MPa, and now it is 85 megapascals. Lower solubility due to the lower level of residual eugenol, because we have used less eugenol, so lower will be the residue. Greater resistance to hydrolysis of zinc orthoethoxybenzoate, and the thermal properties are similar to the zinc oxide eugenol. Applications are primarily used as luting cement and cavity lining for amalgam. Now the calcium hydroxide cements. Presentation is two components. Normally it is present in pastes, but powder is also there. Some products are a suspension in water. On application, water dries out. Difficult to manipulate. Form very friable cavity lining. Mean it can easily be fractured. Solution of methyl cellulose in water or a synthetic polymer in a volatile organic solvent can be used instead of water. Composition of a typical calcium hydroxide cement is calcium hydroxide 50%, zinc oxide 10%, zinc stearate 0.5%, ethyl toluene sulfonamide 39.5%. Zinc oxide, calcium hydroxide and zinc oxide are primary reactive ingredients, and zinc acetate is accelerator, and ethyl toluene sulfonamide is act as a carrier, an oil compound. And phase 2, glycol salicylate 40%, which is primary reactive agent. Titanium dioxide, calcium sulfate, calcium tungstate, these are inert fillers, pigments, and radiopacifiers. So radiopacifier, we can say it is titanium dioxide. Is it? It also can be used as a pigment, and it is also a filler. These three acts as fillers, pigments, and radiopacifiers. Now, chelating agents. Glycol salicylate is a difunctional chelating agent having two aromatic groups, reactive groups in ortho positions. Zinc ions primarily responsible for chelation, with calcium, which is largely unreacted. Hydrophobicity, sulfonamide provides no therapeutic effect and replaced with paraffinic oils, which rendered it hydrophobic and which release calcium hydroxide slowly and which reduces its antibacterial effect. Now, light cured material, light activated calcium hydroxide cements are also available. Chemically, they are similar to toothpaste products. Setting reaction is light activated polymerization. Typical ingredients are dimethacrylate, bis-GMA, hydroxyethyl methacrylate, HEMA, polymerization, activators, and calcium hydroxide. And you people know the activators. Now, setting is under the control of the operator, that is command set. Residual moisture in the cavity not generate in this type of material, or if present, it not generate any influence on setting time. Few second exposure to light is sufficient. Compressive strength is 20 megapascal, sufficient for amalgam condensation, and it is less brittle. Role of HEMA is to produce hydrophilicity because this absorb water and release calcium hydroxide, which creates an alkaline environment. Otherwise, it is hydrophobic. Now, properties, additives which are added into this, they produce a cohesive cement. Compressive strength is very low, that is 8 megapascal, and cannot withstand amalgam condensation. So must be overlaid with the stronger cement, that is it is used as a sublining than a strong cement as a lining. Mixed material have low viscosity and moisture accelerates setting. So if we see the properties, setting reaction is always, as we said, that it is exothermic, and light source also produces some heat, and this is an largely ignored fact because always people says that this is a huge cavity near to the pulp, give a lining of calcium hydroxide. When you people give calcium hydroxide lining, if it is thick, then it generates heat, which will in turn produce damage or damage to the pulp. Or difficulty to apply to cavities in thick section due to consistency of the material, especially in deep cavities. So sublining is advocated. Now you can see Already explained, this is the sublining of calcium hydroxide cement, zinc phosphate cement lining, and then it is the amalgam. Highly solubility and alkaline environment is its property, due to which antibacterial property in deep cavities can be achieved. Exposed pulp, accidental or due to caries, can be covered by calcium hydroxide, where it is used as pulp capping agent. Sufficiently biocompatible to be placed adjacent to the pulp and capable of destroying any remaining bacteria, as already previously discussed. Initiate calcification and formation of secondary, that is reactionary dentine layer. Not the secondary, but it is originally the reactionary. But you can write at this stage, you can write both. At the base of the cavity, secondary or reactionary dentine layer can be produced, which is mediated by the activation of TGF beta. TGF beta is tumor growth factor beta, a cellular growth factor. Calcium not be included in mineralization of the calcific barrier or reactionary dentine. For pulp capping, calcium hydroxide material overlaid with the strong cement-based material like zinc phosphate cement already described before completing the restoration of the tooth with amalgam. Resin-based materials are less soluble but provide antibacterial and regenerative property. Resin-based material mean resin-based calcium hydroxide materials. Now, problem associated with resin-based materials are as the monomer of unreacted methyl methacrylate group is always there. So unreacted methyl methacrylate group becomes attached to a freshly pressed resin restoration. During setting of resin, shrinkage occurs. Shrinkage pulls calcium hydroxide from the tooth and produces a void through which transportation of irritant material take place. Now, not suitable for luting due to the low strength and solubility, routinely used as lining material beneath silicate and resin-based filling material. No adverse effects reported. Form an effective chemical barrier against acids and monomers, because monomers are always present in the methacrylate based materials. Lining material beneath composite is controversial. Cavity margins are sealed by the adhesive, making micro leakage unlikely. So lining acts as a barrier between bonding agent and the dentine and reducing the potential area available for bonding. Which thing is reducing the potential area available for bonding? Calcium hydroxide. Now, it is suggested that exposed pulps be etched and coated with exposed pulp. As I already discussed many times, that acid is not going to harm your pulp. So here you can see that exposed pulp be etched and etched with phosphoric acid and coated with a resin adhesive to give a primary seal. This idea was negated by pulp perfusion study, a technique whereby fluid is pumped into the pulp chamber at physiological pressures during in vitro micro leakage studies to mimic the effects of dentinal tubule fluid flow, and failed to demonstrate complete sealing of the dentinal tubules or dentin tubules, even under ideal laboratory conditions. Some tubules remain patent, mean opens, and these are potential for micro leakage and potential for micro leakage are still present. So consensus is upon these steps that exposed pulp should be capped with calcium hydroxide before bonding composite to dentine. If some dentine present, lining is not required. If cavity is deep in dentine, close to the pulp, place a lining over that area alone, not the entire cavity. Other applications are root canal sealing pastes, contains retarders to increase setting time, because in root canal we have much longer working and setting time, and when retarders are incorporated, setting time is increased, working time automatically extends. How? The answer should be from your side. Think upon that, that how setting time if increased, how working time increase. These are advantageous due to antibacterial and non-irritant to apical tissues. Non-setting calcium hydroxides are also available in powder liquid form and pastes usually present there in our clinics and hospitals, used for dressing in root canal treatment, temporary root fillings of young children, where they can be used or they are used to close open apex through apexification, provided that there is no infection. And now what is the apexification? We can see in children, if we see, they have root opening, wide open root openings. And if we compare these root apex to the of a younger person, of a older person, it should be like this. The root portion is much end of the root apex is much narrow, like this one. If we see, if I show Here you can see this area is wide open, and if we see it, if we consider it as a root, and it root apex, then it is wide open, and this is narrow. So the process of generating apex is apex, and apex is apex of the tooth. So this is the apex of the tooth. So in younger children, apex is quite wide, and when they grow up, the apex will become narrow. So apexification can be initiated through use of non-setting calcium hydroxide. And thanks a lot. Waiting for your valuable comments. So Allah Hafiz.